Hi, Dr. Philip Yu from Laser Med Institute in Orange County, California. And today I'm demonstrating again how we're doing a post-surgical rehabilitation for post-surgery for bunionectomy.
My mind's going in two different
What we're doing here is, because he has a post-surgical swelling and pain, we are using an M6 Class 4 robotic laser, which is painting the surface of the surgical scar to increase healing, circulation, draining all the edema there, while increasing cellular metabolism to drain the inflammation. Also bring in blood flow for healing. Also, I'm assisting with pulse electromagnetic field therapy that puts in ionic waves of pulse electromagnetism to also increase the bone healing. This has been FDA cleared for post-surgical pain swelling and bone regeneration. And then the trifecta is we're using laser edge myofascial release tissue instruments, which I've developed to drain and milk all this edema out. It's going to break down any adhesions that have formed, and this will also help drain all the inflammation and fluid to increase the healing response multiple fold. So you can also see some bruising. That's the dead pooling of the blood, which tends to drain down. So we're also going to effleurage all this edema and fluid out of the plantar aspect of the foot as well. We also had some procedure here at the 5th metatarsal, and we're just going to kind of work around that as well, because he had a bone spur that was shaved off there too. So, and after all these stitches are taken out and the wounds are closed, I'm going to refer to Dr. Paul Kobsky, who's the medical director for U.S. Track and Field, or Ed's going to have a custom-made orthotic made, so he has normal foot biomechanics, so this doesn't happen again. Because the reason why this happened, because he probably didn't have good biomechanics walking, which can cause more irritation of the calcaneus and 5th metatarsal. He was probably walking more on the lateral part of his foot, but the orthotics will give him a more normal gait, heel strike, mid-stance, toe off. So I'm just going to kind of frame around. I'm not going to really irritate the actual the sutures there, just work around that. And here I can feel a little resistance right there. Again, this was inspired by the Graston technique, except those tools are slippery, so I've added a nice masking grip, this part here, so the tool does not slide. It's easier to manage, you get better dexterity, less pressure on the patient, you don't have to white knuckle it, causing your joints to wear out. And what I'm going to do is kind of massage the calf out to drain the fluid up there, stimulate the pumping mechanism of the soleus muscle to drain the fluid. And then we're going to get the handlebar tools. Again, we have the nice gripping here. Make sure the logo is pointing up and the flat part down toward the treatment surface. So I'm just going to massage that out. So usually do it until the skin, you can get like a petechiae rash, or it's nice and red, which means we're breaking down a lot of adhesion, stimulating blood flow. Calves are actually in pretty good condition. I'm going to get the can opener tool. You can see it's we can get right around the Achilles tendon and ankle right here. It fits nice and perfectly right around there. And I could kind of frame where the incision is, not to irritate the sutures, and I can really specifically release all the adhesions around there. And again here, right here, just scoop and milk out the edema right in the Achilles there. Another trick I do is, Ed, I'm going to have you flex your foot as much as you can. Alright, like that. No pain, you're doing good?
No.
So what I'm doing is I'm dorsiflexing his foot, which will further stretch out the Achilles, and that will make his flexibility be restored at a much faster rate as we are breaking down these adhesions, bringing in blood flow for healing, and milking out the edema and inflammation. And before, he can barely even dorsiflex his foot. Now it's like a normal range of motion. It has nice end range pliability. It's amazing. I could kind of use the other edges here to get in those hard to reach areas, crevices here. You kind of frame that right there. I could frame the lateral malleolus right here, work around that. You don't want to rub on the bone, just around it. See how it milks that out really nice right there. How's that feel?
Great.
It's like a nice massage, huh?
Yeah, it
nice
does.
and warm. Again, we're going to work right around the...
I think the bones are very sensitive.
Yeah, so that's why we...
For the shipping and all, but outside that, it's
Yeah, that's why we don't rub very hard around it where they shave the bone off. We just kind of, effleurage the surface just enough to stimulate the circulation and get the edema milked out. But look at that. I mean, before I could press in there and there'd be, see how I could press in there? And you got the pitting edema, but it's been reduced a lot. And I can start seeing the definition of his bones around here and some veins. So, but to push more of that pitting edema out, I get this tool right here. And, well, let me wipe this off, make sure it's... Where's the disinfectant wipe?
Oh,
Disinfectant wipe?
up there. Wipes.
So again, we have this concave tool, can opener type, and that fits right in the dorsal aspect of the lateral. And I see I'm milking that edema and kind of scooping that out. That's got to feel good. Again, I'm framing the lateral malleolus and the fibula and this aspect of the tibia, because we don't want to scrape the bone. Oh, he has adhesions right here. Feel that clicking there? Yeah, we got to break this down.
no pain.
Yeah. I'm going to work a little on the plantar aspect. You can, the plantar aspect as well, you could dorsiflex it like this and just kind of work that out.
No, it's this.
Alright, and then what he would do is, after this I'm going to kinesiotape the foot and ankle, and what I'm going to do, I'm going to do that over the bandages here to protect the scar tissue and the sutures. And the kinesiotape will not only hold the bandages in place, it'll also help in circulation, because it does stimulate the lymphatic system to drain the fluid and give him some proprioception, kinesthetic awareness, because the kinesiotape stimulates all your large diameter afferent fibers, and that stimulates nerve sensations to the brain, and that'll increase his proprioceptive awareness when he's walking, and also tissue around there will heal faster. So, all right, so that's how we do the post-surgical ankle and foot rehabilitation with the trifecta. We have the Class 4 M6 robotic laser, pulse electromagnetic field therapy, and laser edge myofascial release tools. So, thank you for watching.